Hey everybody, it's Raquel
and Esther,
and we are Desert Dialogues.
We're interviewing Ejiro of Modernized Wellness today as part of
Women's History Month. Right? We have been interviewing different ladies in different industries. Well, actually, this is the second one in the health industry because we did a health
or wellness.
She's wellness, but we did skincare and then we did financial wellness. Now we're doing like health, mind. Medical. We're doing aesthetics, so body wellness. So we're out here just, wellness up.
And because we are in the desert, we want to make sure that we are giving opportunities for people to share what their businesses are about, what they're doing, and just kind of give people an outlet to share and to be able to earn your business possibly too.
Definitely. So if you have a business or if you know someone who do have a business and you feel like they may be a good addition to what we're doing, you like our vibes, they might like our vibes, reach out to us. Feel free. It's desertdialogues@gmail.com and Desert Dialogues on TikTok, YouTube, Spotify, and eventually Instagram and Facebook. Eventually, we'll see.
Thank you for taking the time, and we can't wait to share more with you in a little bit.
Thank you.
So, Ejiro, thank you for taking the time to meet with us today. I know that your time is important, and you have clients and things like that. But thanks for fitting us in. So today we want to just basically give people an opportunity to get to know who you are, what modernized wellness is about, what inspired you to start, and just to get kind of general idea about what you do around here in the services. So we'll ask individual questions, but who are you and what is your role or your title?
So my name is Ejiro and I'm the owner. I'm a nurse practitioner. I've been in nursing since I was 16, straight out of high school, and just being in different areas of nursing, I finally just seen the power of intravenous medicines and how it changes patients' lives. And so when I became a nurse practitioner, I knew I definitely wanted to be able to get patients that type of therapy at a cheaper way or easier way to get to it. And so I started out my business particularly for IV therapy. And being in that world, learning about other hormonal balances, I started diving into things like hormonal therapy. When you get in that industry, you want to learn about aesthetics. And next I brought on aesthetics, and then I learned about peptide therapy, which is a targeted therapy part of cellular medicine. And so just really taking more courses and education has really exposed me to all this area of what people may call alternative medicine. And I keep learning every day, and I keep adding on the new things that I feel is really beneficial. I am Nigerian. I was born in Nigeria. My family moved here. I was about 10 years old. Okay. And I've lived here most of my life. Yeah.
So I went on your website and we were talking about functional medicine. What does that really mean in the realm of what you do?
So I don't have my certification as a functional medicine practitioner. However, I do have taken a lot of courses. It's an extensive program for you to complete, and I'm very aware of things that are in functional medicine that we address. So functional medicine really targets the root cause of diseases. So traditional regular medicine, if you say have hypertension, you go to your doctor, they do the workup, they get you on a medication. Where with functional medicine, we will try to figure out what is causing that hypertension and addresses from the root cause. So is it from, say, being overweight? So let's look at why you're overweight. Is it because you have some dysfunction in your gut? We address things like that to really take care of your chronic illness from the bottom up.
So you're not treating the symptoms, you're figuring out the problem.
And then attacking that.
Yeah. In some cases, you have to treat the symptoms so you get to the root cause of it. And that's why traditional medicine is not something that we just frown upon. We use it in conjunction with functional medicine to really get our patients to lead the best life they can.
Okay. Well, I have a question on that. So like with treating and finding the root cause to the problem. Like, how long do that normally take? Do it like varies, or is it like an extended period of time, like a year, and you kind of?
It varies. Every individual, and this type of medicine is very personalized medicine. There's not one size fits all. So it depends on your family history, what kind of toxins you're exposed to, different things. We will do an intense history and physical with our patients and really find those things. Correcting the root cause may take a period of time when we're addressing things like, okay, your gut health. It's not just taking a probiotic and that's it. We do stool testing. We push you on this for a period of time. We do retesting, bring you back. So it is a process. Depending on the individuals, I give expectation and let them know, hey, this is not something that we can take care of within 3 months. It's going to take about a year or two, and just being very realistic with the goals with our patients. But yeah,
So it's not a quick fix.
it's not a quick fix.
But it's a
Yeah.
permanent fix.
It's a permanent fix. Yeah, it's
Lifestyle change.
exactly. So, but yeah, that's what functional medicine is about. Hopefully, I get my certification. But right now, I do address those individual things with individuals. So I have people who come in with things like Hashimoto's, autoimmune disorders. And we address that for them. Gut health, I address that.
So you said IV therapy, things like that. What other services?
So I do aesthetics too, and right now I do a lot of like people know as Botox, neurotoxins. What they do is they help relax the muscles to reduce expression lines. I use fillers to enhance like places where there's volume loss. Things like microneedling, where we take a little pen with needles to cause some damage on the skin to get your skin to heal and give you a fresher looking skin. Chemical peels. I carry a line of professional skincare products as well too. I do what's called peptide therapy. Peptide therapy is kind of new. You know, when you go on the internet, you type peptide, you see things like skincare product comes. Peptide is beyond that. There are hundreds of peptides in our body that we naturally make, and what we use it in my practice is to target and treat things like even gut health, like I talk about, growth hormone imbalances in patients, sexual health, different ways we're able to use it to target to treat patients. I also do hormone replacement therapy, which is very big because a lot of us suffer from hormonal imbalances and don't even know it. So we start out with a questionnaire. And based on the questionnaire, basic lab work, I'm able to see where we're deficient. And since it's a customized plan, I'm able to compound a hormone replacement package that will target specifically what we're trying to treat with our individuals.
So in that sense, would that be good for us? Because I know a lot of my friends, as they're getting older, menopause and things like that. So you'd be the person who would help make sense of it all. Because, being Nigerian parents, well, my parents didn't talk, my mom didn't talk about a lot of stuff. So in that sense, we're out here in the wind, just not knowing what to do on changing. And so those are things that you would.
Those are things, yeah. Yeah, a lot of women, most of our life as women is spent in that perimenopausal and menopausal phase of life. And most of us are having things like difficulty losing weight, midsection fat, night sweating, things like that, And
my consultation.
Those were things that I spent a lot of time on. Education is big. So like you said, our parents can tell us about this. And so really educating and telling individuals, this is, how the body works. This is what's going on as you're aging. This is how we can safely balance things to help you feel better, because you're aging doesn't mean you have to have a lot of the symptoms and be miserable. Yeah. So those are that's what I do with hormone replacement therapy. And it's both for both men and women too.
Okay. Do you with that age of life, the hormone replacement for the women who are becoming men and the men are becoming women?
Oh yeah. So I don't have any client right now who in that population. However, I'm very knowledgeable about taking courses to know how to safely manage hormone replacement for them. And so that's something I'm open to if I have individuals who are interested in that therapy.
That's cool. Yeah.
So I've been seeing a lot of signs, like when I go to the gym, I see signs all over the place about IV therapy and stuff. I'm scared. I'm one of those people like, why can't I just pop a supplement or a vitamin? And what is it doing internally, long term? Is that anything to be concerned about?
Long term? No. So when you talk about IV vitamins, IV supplements, it's just really getting that supplement in a concentrated form of vitamin and hitting your blood vessel. You're getting it straight into your system because anything you're eating is to ultimately feed your body, get into your bloodstream, right? The problem with oral supplementation is that we have to go back to the digestive tract, the stomach. Most of us have stomach issues we don't even know about. So we're not completely absorbing a lot of that supplement. So take a state of being ill, for instance, if you have the upper respiratory infection or flu, your body is working so hard to fight that flu, and it's using white blood cells, using vitamins and everything. So you're very depleted and you need to replace it. So taking oral supplementation will help, but you're only getting so much of it. Where if I brought you in and gave you an IV dose of vitamin C at, say, 1,000 milligrams, you're getting all of that right away. And your body is getting what it needs to fight that infection. So that's where you see someone who did an IV drip for upper respiratory infection recovering 1 or 2 days faster than someone who took an oral for and it's taking 5, 6, 7 days. It's not like you're not getting what you need. You're just getting it probably not as much as you would get with an IV. So an IV is a quick way for you to hit things into your bloodstream faster. With that, there's safety concerns, right? So if you're going to someone who's not knowledgeable about it, maybe there's something that's not correctly mixed in there, that medicine's hitting your bloodstream right away. And so anything fatal could happen. So that's why it's not something.
She's a schedule on me. Like, okay, so when I
That's
get a
why
hangover, I
knowledge.
should come and get.
So can you have an overdose of something like that?
You could possibly have overdose. So supplements like, let's say, magnesium, which is good, the body needs. You could overdo magnesium and cause patients to have like a cardiac event. So this is why education is.
No, we were both like.
And that's why you ask questions.
Yeah.
When I'm sitting you here and putting an IV in, I'm explaining everything I'm doing to you. If you want to know the milligrams of what I'm giving you, I'm telling you. And I don't care if you go on your phone and start Googling it on Google University. But you have to ask questions. You have to be knowledgeable on what we're putting in your body, because that thing's hitting your bloodstream right away. And so going to a provider who takes the extra step to take extra courses to keep advancing in their education, because things are always changing. We're finding out things all the time. You can ask them, where do you get your training at? What do you do? And that's something that we should be able to disclose with you with confidence and not feel like, oh, well, I don't want to tell you what I'm doing. But ask questions so you know that you're getting something safe. Like I said, I've had many years experience of this, even as a nurse, placing IVs, giving IV treatments in a hospital. I've had many years of it. So I'm still learning things as I'm going. Before I bring in any kind of service into my business, I make sure I've taken satisfactory courses. I'm enrolled in extra learning and just really learning and making sure there's safety to what I'm doing first before I start doing it on my clients.
So like vitamin D, my doctor was harping on me, go outside, and I'm like, you see me, I'm always covered up. So I'm like, oh my. So they have vitamin D IVs, and is it 3, 12, 6? I don't know which one I'm deficient of, but how would you?
A lot of us are very deficient on D, and D is very important. It's actually, vitamin is also actually a hormone too. And so vitamin D, you can get it orally, and it's actually, you absorb it pretty well orally. It comes in very different doses. I give it for those who I need to bring up their D level pretty quickly. I'm able to do it IM shots. So IM is in the muscle. So somewhere like the arm, the thigh, the butt. Once a week injection. It's a higher concentration. I'm able to do that. That will help bring it up a little bit higher. I do carry on my shelf a 50,000 unit, which is a higher dose that you can't get over the shelf. You have to get it from like a supplement, from someone like myself. That's one you can take once a week instead of a daily. In about 3 months, that will bring up your vitamin D level pretty high. Vitamin D, you have to be very careful. When you do too much of vitamin D, you can run into problems. So I don't give anybody advice on supplementing vitamin D till I see what your levels are. And we get you on a regimen, and then we recheck at least once or twice a year, no more than 2 times a year, to make sure that you're not getting too high. Because we want you to come up high, but we don't want you to get too high. So there's a sweet spot somewhere around like 50 to 70, 80 is the level that I tell people that I want to see them in their vitamin D readings. But vitamin D is a very important vitamin that people need to, pay attention to. The sun. We have a lot of sun in Arizona. I even think it's enough. It helps some, but you would have to be sitting in the sun for hours.
And get cancer in the process.
Yeah, for you to get that vitamin D level. So that's where the supplementation gets important. We can get vitamin D from nutrition, but it's not as much. Yeah, so you would have to be eating things like eggs, milk, which I really don't like people drinking milk. But
it's a growth hormone for baby calves.
Yeah, so that's where the oral supplementation is fine. And for that one, I definitely tell people, hey, let's do oral supplementation. You don't have to start an IV. Nobody should give you vitamin D IV. I don't think it comes in IV form. It's just the IM shot that you can get it. Yeah.
With checking levels, when we go to the doctor, do you have iPhone?
I do, yeah.
So
I just got an iPhone like a year ago. So.
Well, there's a function on there where you could kind of track your. I connect my my health little app part to the hospital, to my doctor's office, and they upload all my labs. Would you say? Yeah. Where's my
just learned something.
Yeah, you could go and you literally upload.
Is it a specific lab that you have to use, or
yeah, it's just
your eye health?
Yes, my health.
Okay.
And it tracks everything, but I could have.
I've used that app before, but I didn't know you could make your labs.
Yeah, you could do your labs.
Oh,
Let me try to find it.
Okay, so
I'll show it to you later.
Yeah, but that's pretty neat, yeah.
You could track everything, and I gotta find it. I forget.
So it has to do with the EMR, which is the electronic medical record that your doctor's using.
Yeah.
They're making them where they're compatible with a lot of things that we use, like your Apple Watches. So it's good because your doctor can even probably see what you're putting in it.
So
okay.
I was like, for my last labs or whatever, that have
vital signs and all that. Okay, good. That's neat. Yeah.
If they have something like that, would you build based on that, or you would do your own stuff?
in addition.
It depends on what I'm seeing them for. So if you're coming in for like hormone replacement therapy, right? When you go to your primary care doctor, you don't check at all of that completely. So I would take what I need off of what you have. And how long ago was it? Was it in the last 3 months, right?
Okay.
And then when you're checking for hormones, for women who are still on their cycle, the timing of when you check your hormones is very important too. So I don't know that the doctors really would say, hey, come on day 19 of your, after your, no, they wouldn't say that. You just check your blood work. So that's why in that instance, their blood work may not be satisfactory enough for me. Is that if I knew, okay, they waited till the day and they collected everything I need, then of course I would use the labs that you have. There's no point poking you and getting another set of blood work, if you have that already. So I do use the labs that I have patients come with. And even for weight loss, I didn't mention this, I do medical weight loss too.
I know you mentioned something about some soups.
Yeah, so I do medical weight loss, which is one of the biggest services that I have right now. So I have people who come with me who already have some sort of blood work from their primary care doctor to try to see if they can get on the newer weight loss medicines, which is the GLP-1s, semaglutide, Ozempic, Wegovy. They all go by different names, the same thing. And so I take the labs that they've done with their doctors. Those are typically what I need. Like the doctors would do check a blood glucose level over the last 3 months, check cholesterol levels, check thyroid levels, kidneys and livers, just to make sure the organ's okay.
And do you work with men? Because I know as getting older, I'm hearing other friends and stuff. Their thing is the testosterone shots. It's the big thing now.
Oh yeah.
When can that be? Can it ever be too much? Like, how long is somebody supposed to do that? The rest of their lives?
So with testosterone replacement therapy, women do it too. Men do testosterone because that's the main hormone that men make. Men make progesterone, estrogen. Women, but theirs is at a higher level compared to us, right? It's what gives them that manly, they feel manly, right? And so when these are deficient, there's a lot of symptoms that some alone will have. And the moment you start replacing them, as long as their system, everything's functioning well, they start to feel much better. Their mood changes. They're going to the gym. They're lifting more. The muscles coming out, they feel good. And sometimes there's a tendency like, maybe if I go a little bit higher, I'll feel this, so you have the tendency for that to be sometimes abused in some cases. So it is considered a controlled substance. So I do monitor patients on that. You can overdo it. When you get too high of a testosterone level, you start to have symptoms like some of them have cystic acne in their skin. They start to develop man boobs. Other symptoms.
And they have like like breathing issues. Because I read something the other day, something about CPAPs, and then their breathing could be difficult.
No,
Breathing.
testosterone.
Oh, I thought you said breathing.
No, breathing.
Oh, okay. I was like, breathing.
Oh, my breathing. How does that affect their...
No. I would think when you're talking about testosterone replacement with things like sleep apnea is being overweight sometimes could make things like sleep apnea be more pronounced or worse. And if you wanted to lose weight, being on testosterone therapy may lose weight on that. And things like your apnea may get better when you're on it. The only negatives that you would see when you go on the internet and Google testosterone replacement for a man is things like cardiac events that have heart attack or stroke, And if you have to look at those research articles in details. I break it down with my patients and show you that it's not credible articles that I would say, because there's better articles that have shown that men that have been on testosterone replacement therapy actually live longer, did better, their health actually improved way significantly. And it's encouraged for men to be on replacement therapy for testosterone.
Like weekly shots?
It's a weekly shot, yeah. There are creams that they can use. There are pellets that we can insert underneath the skin. That's it dispenses over 3 to 4 months, so they don't have to do the weekly injection. So there are different forms that we can utilize. But once you're on testosterone replacement therapy, you're going to be on it because once you get off of it, you go back to your baseline. So this is where things like peptide therapy I do is really important, because it's more of in the cellular medicine aspect of things. So I'm addressing how can we get your body to naturally make testosterone. Is it because you are overweight, you have a lot of estrogen level? How do we get that estrogen level to come down? So because your body is meant to function and make a certain amount of testosterone. So we look at things like, since we're talking about men, I would ask, how do you heat up your meals at work for lunch? Do you use a plastic container and you're heating that up in the microwave? Because that leaks things that affect your hormones. Yeah. So it's cutting that out, throwing away the plastic bottled water, and start using glass. Pesticides. Yeah, a lot of things, even the air we're breathing is affecting our hormones. We don't even know it. So when we address those things, which kind of falls down to root cause treatment, then you may not necessarily need that testosterone shot, because your body is going to be naturally making its own testosterone now, which it's supposed to be doing. Now, keep in mind, as men age, testosterone level is going to drop as they age, but it shouldn't be dropping at alarming rates like it is right now with young men. I've seen guys come into my clinic here in their early 30s with testosterone levels that are 200. Just to put in context, your testosterone level should be anywhere from 400 to 900, 1,000.
So what's causing that? The food we eat?
It could be the food, what you're exposed to, toxins. It could be being just overweight.
Alcohol,
alcohol is sugar. It turns into sugar is very bad. That alcohol can affect it. And one thing I always tell men, marijuana does lower your testosterone, and they don't know it. I think when people hear that, they're like, "Oh, maybe I should quit," because this could be marijuana use, chronic marijuana use does lower testosterone.
That makes sense.
Levels. Yeah. So many things. There are men that may have some sort of testicular injury, trauma that can affect low testosterone levels. Some people are born with other disorders that can affect testosterone levels. So there's so much to it. That's where your consultation becomes very important, to find what the cause is. You just don't go on the internet and buy testosterone. I need this because my gym buddy told me to take this.
So I've heard of these, the commercials, Vital for Men and things like that. My concern with that is that's what they do. So would they, at any point in time, if something was affecting you negatively, I'm sure you can't speak on this probably because, know, but my concern is if somebody is based on testosterone shots, if the person's heart or something was being affected, being that that's their form of making money, would they be inclined to tell you, hey, you need to...
Well, it depends on where they're getting it, right? If you're coming to a practitioner like myself, we have due diligence. We have to let our patients know that we don't think you're a safe candidate or you're doing something that is not beneficial to you right now. You need to stop. I always have all my clients, if I don't do a physical for them, have them go to their primary care doctor, do a physical every year, make sure they're checking their heart, all their organs to make sure everything looks fine, doing a colonoscopy besides just taking a shot, because... Yeah, you don't want something you're doing good to turn out to be bad or negative for you. So that's where some of those articles that you read of negative is from people who probably are doing other things in conjunction, not following the regimen, or maybe, I don't know, like getting it off the internet, things like that.
Right.
Yeah. So you have to read research articles and to the detail to see. I do clinical trials right now for a company for weight loss. And, you know, there's so many details, so many things that go into that. So you have to really take the time to read those, you know, trials and see what the population was like, you know, things like that. Yeah.
Makes sense.
Mm-hmm.
Guys, I don't think guys like realize like the importance of their health. They're just like, oh, I'm just a guy. Like, I don't get sick. I don't need that.
Yeah.
Testosterone.
Because it makes them feel weak if they have.
Oh, they're sticking their finger in the blood.
Yeah.
Check their prostate.
I'm going to the doctor. They're about to poke my booty.
Yeah.
They're about to take my manhood for the sake of health. I'm just going to
lack
die.
of education, you know.
Take 10 years if you want to. They say,
Yeah.
like, take my 10 years. I'm not going to the doctor. I'm like, oh my God.
I see men do really good when they talk amongst themselves.
Yeah.
Do they talk about things? I know women feel comfortable,
We do.
but I feel like men don't.
Start fostering that kind of conversation amongst themselves. If they do and they have that conversation, they realize that all that thinking is just far from what it is. And they will know what the importance of those things are.
Yeah.
Someone like the Black Panther actor who passed away at such a young age of colon cancer, you know, people were thinking like, well, he's young, he's about my age, what do I need to be doing? So when they see things like that, that can spark up conversations. And so now we know the importance of getting a colonoscopy, especially as a Black man. You have a higher risk if you have a family history. This is why you should be doing it. Yes, it's uncomfortable for them to do that procedure, but think of how you could save your life, you know, and prevent things that could be deadly. So it's the education, the conversations, maybe seeing podcasts and listening to podcasts like this really helps. You know, people that look like yourself talking sometimes helps our population too, because they have a little more faith in someone like themselves.
Yeah. You understand being my body and how I feel.
Exactly.
Right. So what sets you apart as a practitioner, I suppose, outside of, I mean, I love the fact that you're talking about education, you have a process, but is there anything else that sets you apart? Something you're like, you know what, I'll travel all the way down to Scottsdale from Buckeye to see Ejiro.
I was going to schedule my consultation.
Yeah.
I live in Buckeye. She's talking about.
Yeah. What sets me apart? I would say, you know, you're going to go on the internet, you're going to Google functional medicine. A lot of practitioners are going to come on. And it's hard for you to tell off of people's pictures what sets you apart. You almost go with like the reviews, how they look. They look like they're nice, maybe how pretty their website is.
Yeah.
Ultimately, I think, and if we are all knowledgeable, let's just say we'll get like really good training, you know, what sets us apart? I think when it all boils down to like personality, really someone that can relate to you, someone that you feel like is listening to you when you're speaking, because our type of practice are mostly cash-based practices, and so if you're coming in, you're spending $200, $300, $400 on a consultation for an hour, you're expecting to get that 1 hour, and you're being heard, you're listened to, and you know you're taken seriously. So if you go somewhere and you don't feel like you're getting that for the value that you pay, you know that you can leave and you can go somewhere else. You know, so that's where personality becomes a big part of what sets me apart. Making sure that I'm relatable to my clients, I'm available to them. I'm a solo practitioner. I've dabbled on the idea of expanding and getting bigger, but as of this year, I've decided not to and just keep me solo the way I am, because I like to be very connected with my patients, to know what's going on with them and me alone. I feel like adding more people, expanding, will take away that special part of why I'm doing this. So I keep my practice small. I don't have a whole lot of clients that I want to take on at one time. So I'm really spending time. I'm available. I have patients texting me at 10 a.m. I don't encourage it. That's not today at 10 p.m.
Yeah.
I don't encourage it. But if it's anything of importance, I've always told them, I'd rather you text me than for you to sit there and suffer, you know. So I'm definitely reachable if needed. I go the extra mile, and as far as educating myself, if there's anything up and coming new, I bring it at the forefront to my patients. And I always make sure I try a lot of the things I do first personally, so I can speak from a personal experience too with them, because they would like to know, like say aesthetics, for instance, right? You know, I was before I got into this, I was like, I don't need any of that. And then you have clients come and say, well, have you tried this? You know, they feel some type of way. I feel
You're like,
when you're like, I'm not. So
I heard
I do try those things. You know, I'm not opposed to it. Poke. I don't mind using it as a test sample to poke and prod and do whatever. So that way I can come from that perspective. Like, I've tried that. This is what it feels like. You know, this is what it is, and give you that first hand experience. So I feel that being relatable. One of the things I do, I kind of talked about, is called peptide therapy.
Mm-hmm.
I've spent so much money and so much education to really learn more about peptides. I'm always constantly doing it. I go to conferences on it. That's something that right now a lot of people are trying to get into, but there's FDA restrictions on getting those peptides. What sets me apart is that I'm part of a group where I have limited access to some of those peptides over a practitioner who's down the street. And so I have people who would call me specifically from different states, like, I want to get on this peptide, can I get on it? If you go on the internet, you could probably find those peptides, but they're for research use. They're not for human use. So that's the difference between me and getting that off the internet. Is I would get you actual peptides that are intended for therapeutic use, you know. And so that's something that I guess specific niche clients come to me for, is that peptide therapy. Those who know about it, they know about it, and they know the benefits. So, and I provide information. So I have a customer right now who, we have a long thread of email, and she goes on it. It's like, well, I found out about this peptide. What does it do? And she goes again. And so, you know, I try to have the pamphlet for them with basic information that's not overwhelming, but easy to understand. This is what it does. This is how it works. This is what we do, the protocol. And so that's the one thing that sets me apart right now from a lot of providers here. I'm seeing in the Valley is just being able to have access to peptide, which the FDA has really limited a lot of that as of late last year.
Yeah. So what do you see for Modernized Wellness? Do you see yourself expanding in terms of adding more areas of medicine to your practice?
Yeah, so I am anything up and coming, cutting edge. I will be on the forefront. There are things like ozone therapy and some newer I've not really gotten my hands on that yet, but by the end of this year, I definitely want to get into that because that's been new and upcoming, and it's just been really, really, really great.
ozone therapy.
It's like an IV infusion. I honestly, I'm not going to speak on it because I've not done that.
Now I'm just like thinking,
yeah. So anything up and coming that I feel my clients would benefit from, I definitely would add that on, without really overwhelming myself too much. Because again, I'm a solo practitioner here. There's only so much I can take on and do, you know. So I will, like, even the aesthetics, like, I've had to really limit what I do on the aesthetics because it's like, I don't want to be spending time doing procedures when, you know, I need to do this for my patients. Because I'm not saying aesthetics is not necessary, because when you get people to look good on the outside and they feel good inside, they feel so much confidence. So that's why I offer that in complementary to my hormone replacement therapy, because I want the whole overall person to feel really great inside and outside. But, you know, I can't do it all, so I have to limit certain things I can do. But being part of cellular medicine, which is my ultimate goal, I definitely, anything that's related to that, really targeting chronic conditions on a cellular level, I will add that and I'll bring that onto my practice.
Yeah. No, that's good. It's always good to have. And I feel, you know, we're all entrepreneurs and you're a solo practitioner, but it's like, you know, business owners. And it's like, there's so much you want to learn. I know for me, I like to dibble and dabble in a lot of things, right? But I feel you when you say, like, you limit, because you realize, like, maybe that time spent's not as valuable as time spent in this area.
Yeah.
So it's like, and then you don't do your clients justice by spending all this time on this side. That's not really, I don't know, I'm not saying it's bad, but it's just, maybe it's just not.
The way I say it, my mom always says, it's like, jack of all trades, you know.
Master of none.
So I don't want to be that, you know. I really want to, you know, not have a little bit of everything, but I really want to be good at one thing, one area, you know, with my patients. So if it means letting go of some of the fillers and facial contouring that I want to do, BBLs, whatever, I would let go of that, because I feel like really addressing chronic conditions on the cellular level is way more important for me and my patients, because that will save people a lifetime, generations of chronic illnesses. So for me, that would be what I would focus and put more attention on.
I love that because you're like more so focused on the inside, and you know the outside take care of itself. There's solutions for that,
Yeah.
but there's not a lot of people who are focused on inside.
Yes.
Like they are, but they're like shoving stuff down your throat or making you buy this special program, and you know it may not actually work because they're not like you said, you do a consultation, you want to know like everything, like where are we imbalanced at?
Yeah.
Like where do we need to start? And there's not too many like doctors, you know, they're just fixing the problem temporarily, but you're like, I want to fix the problem permanently.
Yeah.
Like,
and not to knock like your primary care
no,
doctor.
yes, I respect them.
You go there, like you come in. It's like I've worked in clinics where we would have like 5 to 6 patients in an hour we have to see. That's like 10, 15 minutes per client. So when you're coming in with your long list of stuff, it's like, well, I gotta see the next one. They're waiting. If not, they're gonna eat into my lunchtime, you know?
Yeah.
So and that's what you have to do almost to be able to make ends meet or to meet your quota for your job, you know? And so having something like this, yes, it's gonna be a premium, but if I'm telling you have an hour consultation with me, that whole hour is your hour to really let me know what you want.
Yeah.
You know, and the way I practice here, I don't charge people for follow-ups. Like you can call me and text me. That's why I keep it just me by myself, because things like that don't bother me. Other people where they're like, oh, well, that's 15 minutes of my time. I gotta charge this person that, you know. So really getting what you pay for, basically. Yeah, you're gonna get everything that you're paying for. You're gonna be listened to. Your concerns are gonna be addressed. You know, and then the other part is you doing what I asked you to do. You know, if I tell you this is the package I want you to get, blah blah blah. You know, it's not because I'm trying to make a lot of money. It's because this is what I think you'll benefit from. So I give patients options. I don't know if I've sent you a supplement recommendation before.
I know we talked about my husband, and you gave me a recommendation, but you said at the same time, you're like, I would need to talk to him and see what it is that he wants. I know what you want, but
so like, some of my supplements, you know, I get a lot of questions like, should I be taking the supplements? I'm like, yeah, I know. You know, where are you getting it from? Because supplements, there are not a lot of regulation of them.
Yeah.
You know, they tell you have this and that. When you look deep, you go do your own research, it may not be a lot of what they say is in there, right? So I usually go with specific brands that have extra testing that justifies what they are putting in there is really what they put. So I would send you several options. This brand is a brand I like. This is another brand I like, based on the price point. So one of them may be $50, the next one $20, then $5, and you have that option to pick which one you want within your budget. So I'm very considerate when it comes to budget, because you know you don't want people to spend a whole lot of money and feeling like, hey, I'm not getting any. I don't feel great. You may not feel great like the first 3-4 months. I'll be honest. That's why you have to stick through the whole process. And if you're not feeling great,
you see me huffing and puffing. I said the same thing. I'm like, what's this supposed to do again? Because I've been taking this for 6 months and I don't notice anything.
Exactly. And that's why follow-up is important. Okay, so you're not noticing. Do we need to tweak things? Do we need to? Maybe that's not what we really need to address now. Maybe we need to address this. So it's not a one solution. It's a continual relationship with the provider and following up and all that.
Okay, makes sense.
I have so many other questions, but we're going to cut it short because your time is valuable.
Okay, well, I do have a question. Okay, so we mentioned supplements, and I know I'm not going to like pick at but what would you say? What's your thoughts about hum nutrition?
HUM?
Yeah. They have like the green cleanse.
They have like the gummies.
And the gummies.
Oh yeah, I think I've seen them pop up on social media. I've never looked into them.
Oh.
I use Full Scripts for my sister.
Which one?
It's called Full Scripts.
Full Script.
That's where you get supplements from. That's what I use professionally. And I always tell my clients, if I don't see that supplement on there, that brand, I don't trust it.
Really?
And personally, that's me, because a lot of the brands that are on Full Scripts, I usually trust in brands, like brands that, you know, when it comes to testing with supplements, the companies have to do extra testing on their own, out of their pockets, things like that is what I've heard. And so me seeing several stamps of companies that have done several testings out of their own pocket and independently, It lets me know that they're showing you that we've got this extra step to tell you the vitamin C you're getting here is 100% vitamin C. It's not 25% vitamin C and 75% fillers. You know, that's another reason why taking oral supplements. Why am I not getting better?
Yeah.
Are you truly
Nature
getting? Yeah. You know, Nature Made is a very big brand. I can't speak on it because I'm not really looked into it. But I just, you know, I can go on the website and say I think they have like GSP rating or something on it. But
Is that good?
I think that's a good company. Yeah, something like G.
I heard it has a lot of fillers and stuff like. But then again, I don't know what I'm looking for. It just sounds. I see nature. Man, sounds good.
And that's what I teach people is how to read a label. You know, we take one of those supplements and I show you on the back. You know, I take a daily supplement right now. My husband looks at me. It's like 6 capsules of a multivitamin. You're like, why don't you just take one a day?
Yeah.
When you start looking at supplements, you realize that one a day cannot pack the amount of vitamin A, C, D, magnesium, and everything that your body needs daily. And so taking one a day, are you really taking everything that you need? It's just a little bit of everything. And if we really deep dive, and we can do micronutrient testing to see what you really need and even be more customized with your nutrients, supplement taken. Yeah. So that's why I go with specific brands, because I look at the label and I see, okay, well, this has about 500 milligrams of magnesium. That's what I want my patient to be on. You know, you find a supplement that has only 50.
Oh,
And you're like, hey, I'm taking a multi-30, you're taking just a little bit. How much of your body is your body really absorbing when we talk about your gut health, right? So that's where something like supplements becomes very important. And I do offer that as an education for my patients, recommendation. I always ask them to always add them in conjunction with whatever regimen, because you may eat all the vitamins, all the vegetables, but now we're going to start looking at how those things planted. Are they organic? You know, are you really getting what you're supposed to be getting?
Yeah. So we may not really be doing as much justice as you think we're doing. A lot of times, like I buy my fruit at Sprouts, but again, like you just said, it depends on where did it come from.
Yeah.
Are they putting hormones in the meat you're eating? I mean, there's all kinds of stuff.
So many things, yeah.
So
Even the ones that are saying organic, are they really organic? Were you
you just slap organic label on there just to get me to buy it.
Yeah, so that's where we see things like weight loss, which, like I said, is one of my biggest service. I see people who struggle no matter how hard they're eating healthy and exercising, they're still not getting to where they want to. They're not losing weight. You know, it really makes you start thinking, you know, people quickly say, oh, well, you're lazy, you're not doing enough workout, this, that. No, I've seen people who are doing everything right and still not able to lose weight. Then you start thinking, why? You know, you start looking at your sleeping habits, where you're working, the kind of toxins that's affecting you, the foods you're eating. Are you eating really organic, or are you eating things that have pesticides that's been sprayed on them and that's affecting your hormones and making it hard for you to lose weight? So that's...
Or the sugar-free.
Yeah, and I don't do sugar-free. I tell people.
Yeah, sugar-free, but you look at the back, it's erythritol.
This week I told my dad about a new sugar that him and my mom should be eating. It's called Trehalose sugar.
They should or should not?
They should be eating instead of regular sugar. And I told them the price, he goes, forget about it. Like, in the long run, this is going to be better than...
Like, no.
So it's like the price point's got to come down several notches.
Yeah. The price point, it's not even expensive, like $16 on Amazon.
For like how many ounces?
I forgot how many ounces, but I think it's about...
He looked at it and said, no. So.
But it's good sugar, you know, because sugar is one of our biggest problems in this country. Sugar. And sugar is good. It's the type of sugar that we're eating.
Yeah.
You know, so that's,
It's cool. Well, thank you.